I don't dare talk about expectations. What I want is for it to flatten more. As we talked about, it really is the first 14 days we might not yet see a difference, and that's because we know people have already been exposed, and we know that we're playing catch up a little bit with the cases that we've seen arise in the last week, where some of them have exposed others, sometimes larger groups of others, and that's the public health work that is ongoing today. When we talk about the testing strategy and focusing on the clusters and outbreaks that we're finding in our community, that is happening around the province right now. And that's going to mean that there are still people who are going to develop this disease over the coming 2 weeks. But if all of us have done our part, and I'm starting to see some glimmers of hope, if we will, that we've flattened out, our increase, our trajectory has leveled off a bit. We need to see that continue, and of course, ideally, we want to see it go down. We probably won't be seeing it going down for a while yet, but this trajectory allows us to maintain our health system, allows us to be able to provide all of that important health care to people with COVID-19 as it's needed, but also to everybody else who needs the health system care. So it is, I think, it is working, and I want to tell people that what you're doing is making a difference, and we need to keep it up for the next coming weeks. Estimations of numbers, there's models that help us do that, and I presented our expected, the numbers that we're seeing right now is about 130 cases per million. That would give us, what we, in the range of 2,000 to 3,000 people probably in the province that were infected at that point in time. But again, these are just models. So our testing strategy has been to test widely, and we know that there's transmission happening in communities that we don't recognize, and that's where we have to focus our testing and our public health response on those as they pop up. I don't know when we're going to see our peak, and the challenge of the work that I do, and I presented the epidemiologic curve, is that we don't know when we're at the peak until we're looking back at it. So there is nothing that would tell me that we can back off in any way right now. Our peak may be, hopefully, long and flat, so that we're not getting those spikes and dramatic decreases. If we're really lucky, our peak will be flat and flatter. But, we don't know that. We can't predict that right now. And so obviously we used what we had available, and as you can see, Italy has now probably leveled off. It's not on the downswing yet. And we have been putting in the US as well. I don't believe that we need to redo the modeling. The scenarios that we're seeing in the US are very much like Canada, where different states have different issues going on at the same time. So modeling all of the USA is not likely going to give us much difference. I think the scenarios that we have, or I believe the scenarios that we have used, are ones that will keep us in good stead. Our modelers are, of course, factoring in all of those new numbers to see if there's anything else that we need to prepare for. But as Minister Dick said, and I've said, we are going to have our own epidemic. These are just a basis for change. These are things that help us say, okay, what do we need to have in place? And the exact numbers are really, in my mind, not that important. It's much more about how are we managing? Are we within our capacity? Have we done everything to ensure we know what our capacity is and where it is, and put in all of those pieces that allow us to cascade up if we need to. So we will be factoring in, of course, some of the issues from the US, but I don't believe it will change any of the work that we've done to date.